Mary Johnston Hospital is a non-profit mission hospital located in the very heart of Tondo, Manila. Celebrated its 100 years of faithful and dedicated service to the community. Its mission is to provide the highest standards of medical care, community service, quality education and training, to fulfill the Great Commission which the United Methodist Church is committed to. On December 10, 1906, Dr. Rebecca Parrish, a missionary doctor from Indiana, USA, opened the doors to the Dispensaria Betania in the first floor of the Bible Training School for Women in Santa Cruz, Manila, thus laying down the foundation of what is now the Mary Johnston Hospital. Having received accreditation from the Philippine Department of Health, DOH, the Philippine Health Insurance Corporation, or PHIC, the Philippine Hospital Association, and the different specialty societies, MJH has also grown to become a tertiary and paramedical training institution with a recognized residency program in the 4 clinical departments, namely medicine, surgery, OB/GYN, and pediatrics. Hundreds have graduated from the residency training program, many of whom are now successful and respected specialists in their chosen fields. As part of Mary Johnston Hospital's mission to strengthen its missionary work within the community, the hospital implemented in February 2001 a program to adapt communities within the neighborhood of Tondo. Although primarily a community health outreach program, Mary Johnston Hospital's project touches upon a much wider range of issues and concerns for the surrounding communities. The first community to be adopted by Mary Johnston Hospital was Barangay 38 from February 2001 to December 2002. To help Mary Johnston Hospital, the assistance of the Methodist Commission on Resource Development, or MCRD, was stopped. Initially, a facilitators training program was conducted among selected MJH employees and community leaders. To further strengthen its community outreach program, Mary Johnston Hospital partnered with the CCT, or the Center for Community Transformation, a non-government organization. The purpose of the partnership with the CCT is to enable the hospital to provide holistic development to communities as part of its mission. Since the CCT is an established organization with developed roots in various communities within Tondo, Mary Johnston Hospital could then serve as a support arm for the organization, providing health services and enhancing its various programs in education and leadership, evangelism, and social service. Under this new partnership, the Parola community became Mary Johnston Hospital's new adopted community after the initial outreach program conducted in Barangay 38 ran its course. The Parola community is one of the most indigent communities in Tondo and is of the communities being served by the CCT. Mary Johnston Hospital has different health programs such as milk feeding, community clinic, immunization, health education for mothers, and CCT coordinators. The various topics include lectures on diabetes, dengue, and typhoid fever, prenatal examinations, and wound care, among others. Now in its centennial year, Mary Johnston Hospital continues its healing ministry in the indigent areas of Tondo, Manila. From its humble beginnings, the hospital's operation has grown to include facilities for major operations, OB/GYN, medical surgery and pediatric care, X-ray and ultrasonography, CT scan, clinical laboratory, intensive care units, hemodialysis, endoscopy, and others. Mary Johnston Hospital has a staff of 34 resident physicians, 117 active consultants, 63 visiting consultants, and 16 associate physicians, as well as 86 graduate nurses and 234 salaried staff. As in Dr. Parrish's time, Mary Johnston today continues to accept all who come to its doors regardless of color, creed, religion, or political persuasion. Even with limited resources, the hospital strives to provide the best services it can afford, and that is the reason why Mary Johnston Hospital is known for quality service.